If you've ever Googled home care near me, assisted living in Long Beach, or nursing home versus in-home care, and walked away more confused than when you started, you are not alone. Most families I talk to are juggling all three of those terms and have no idea what actually separates them. And that confusion, it delays getting your loved one or your elderly parents the help they need. So today I'm going to break down all three: home care, assisted living, and nursing homes. Clearly, simply, and without any industry jargon. By the end of this video, you'll know exactly what each one is, what it costs roughly, and how to figure out which one fits your family's situation. My name is Kreisler Ng, and I'm the owner of Right at Home in Long Beach, a home care agency located right here in Long Beach, California. We serve families across Long Beach, Lakewood, Bellflower, Signal Hill, and the surrounding communities. Families just like yours, trying to figure out the best way to care for someone they love. So, without further ado, let's get to it. So, what does a home care agency actually do? Here's the simplest way I can put it. A home care agency brings professional caregiving support directly into your loved one's home so that they can stay where they're most comfortable, most independent, and most themselves. And that's it at the core. We come to you. There's no moving, no giving up the bedroom they've slept in for 40 years, no leaving the neighborhood or friends they've known their whole life here in, for example, Long Beach. The care comes to you. Now, home care isn't just one single thing. There's a spectrum of services, and understanding where your family falls on that spectrum will help you figure out exactly what you need. So, level one, companion care. This is where potentially a lot of families start. Maybe your mom is physically doing okay, but she's lonely. She's isolated. I've made videos about aging seniors that are isolated and depressed. I mean, she's forgetting to eat lunch, or she's stopped going out afternoons or doing social events. Companion care is exactly what it sounds like. A caregiver shows up, builds a real relationship, has conversations, plays cards, helps with the errands, and makes sure your loved one is engaged and not isolated. This is also sometimes called non-medical home care. For a lot of seniors right here in Long Beach, this level of care is genuinely life-changing. Not because of a medical need, but because of a human one. So really focus on mental health. Level two, personal care. This is where things get a little more hands-on. Personal care covers what we call activities of daily living, or ADLs. Things like bathing, dressing, grooming, toileting, and mobility assistance. If your dad is starting to struggle getting in and out of the shower safely, or your mom needs help getting dressed in the morning or getting out of bed, that's more on the personal care side. It takes a trained professional caregiver to do it with dignity and with skill. This is the most common level of care we provide. It's the heart of what a home care agency does day in and day out. Level three, specialized care. Some agencies, and this varies, also offer or coordinate care for more complex medical needs. Things like medication management or working with clients who have Alzheimer, dementia, or Parkinson's disease. At Right at Home, we work closely with families navigating memory care needs and help coordinate with healthcare providers so that the care plan is consistent from the doctor's office all the way into the home. Now let's talk about assisted living, because this is the option that most families explore right alongside in-home care. Assisted living is a residential community. Think of it like a private apartment building specifically designed for seniors. Your loved one moves in and they live there full time. The community provides meals, housekeeping, social activities, and some level of personal care support depending on the facility. Assisted living is a genuinely good option for some people, especially seniors who are isolated at home, who thrive in a social environment, and whose care needs fall somewhere in the middle ground between fully independent and medically complex. But here's what I see most often. Families tour 2 or 3 assisted living facilities here in, let's say, the Long Beach area, and then they call me because their loved one doesn't want to leave home or because they don't need the full package that the community provides. They ultimately just need a few hours of support each day. Or because when they ran the numbers, they realized that home care at 20 or 30 hours a week is actually comparable to the cost of assisted living, without the move, of course. Assisted living in California typically runs anywhere from $4,000 to $7,000 a month. And of course, in LA County, it might even cost more. Obviously, this depends, of course, on your location and the level of care included or needed. Home care structured around your loved one's actual needs can often come in at a similar or lower cost, and your loved one gets to stay at home. And if it's a caregiver, it's one-on-one coverage or care for your loved one. That's not to say, of course, assisted living is wrong. I work with a number of them. It's to say that don't assume it's the only option before you've had that conversation. Then there's nursing home or skilled nursing facility. This is a different category entirely. A nursing home is a licensed medical institution. It's designed for people who need 24-hour clinical supervision, for example, IV care, wound management, post-surgery recovery, or medical conditions that genuinely cannot be managed safely at home or in a residential community setting. In that case, nursing homes are the right answer in the right situation. But they are often the most expensive option, with costs in California running anywhere from $8,000 to $12,000 a month or more. And they are not the right answer just because someone is aging or needs help with daily tasks. That's what home care and assisted living are for. If your loved one's doctor has recommended a skilled nursing facility, that's an important conversation, of course, to take seriously. But if it's just trying to figure out what comes next as your parents get older, a nursing home is almost certainly not where the conversation starts. Now, I know cost is always on people's mind. So let me quickly touch on how families actually pay for these things, as I mentioned some numerical numbers already. Home care can be covered through private pay, long-term care insurance, and in some cases, VA benefits. Also, some other Medicare Advantage programs have a small amount of hours covered for home care. If your loved one is a veteran, going back to VA, or a surviving spouse of a veteran here in Long Beach, the VA's aid and attendance benefit can significantly help offset the cost of in-home care. We work with VA benefits directly at Ride Home Long Beach, as we are accredited, and we help you understand what's available. There are also California state programs worth exploring depending on your situation and your loved one's financial picture. The bottom line, don't let cost be the reason you don't make a call. Let us help you figure out what options are actually on the table for your family. Look, navigating care for a parent, a spouse, or someone you love is one of the hardest things a family goes through. There's guilt, there's fear, there are a million questions coming at you all at once. My hope is this video answered at least a few of them. If you're comparing home care, assisted living, or nursing homes for a loved one in the Long Beach area, or if you're just starting to ask these questions, we would be honored. I would be honored to be part of that conversation. Just a real honest talk about what your loved one needs are and whether you're the right fit to help. The link to reach us is on our YouTube channel, as always, and will be in the comments as well. Call us, visit our website, check us out, or just send us a message. We're local, we're here, and we're ready to help. If this video helped you, please share it. Because I promise someone in your circle or in your friends or in family is going through the exact same thing right now that doesn't know where to start. Thanks for watching as always. I'll see you in the next one.